cancer is the third leading cause of cancer-related deaths in men and women in the United States. It's expected to cause more than 50,000 deaths this year alone. But the death rate from colorectal cancer has been dropping in both men and women for several decades. One reason, polyps are now being found more often by screening and removed before they can develop into cancers, or are being found earlier when the disease is easier to treat. Today we want to talk more about just how easy it is to screen for colon cancer. Michelle and Brenda join us today from Texas Tech University Health Sciences Center. You guys have a special program, Get Fit to Stay Fit. Kind of talk us through it, what exactly it means.
We do. Again, we are with Texas Tech, and it's the Get Fit to Stay Fit colorectal cancer screening. What we do, we service the 26 counties of the Texas Panhandle. We provided education and a free at-home kit that people use. They mail it back in. I mean, it's all completely no cost to the patient, ages 45 to 75, and regardless of the insurance status, regardless of their income, we take care of them. If the at-home test leads to colonoscopy, we also take care of that as well.
Okay, so talk to me about an at-home screening. I don't guess that when you say at-home screening for colorectal cancer, I'm like, what? What does that look like?
So most people don't realize how easy it is to do screening for colorectal cancer, and that's why we have what are called FIT tests. It stands for fecal immunochemical testing, and it's a very simple test that we give to patients and they do in the privacy of their own home. What this test does is it looks for blood in the stool, which can indicate that you might have a polyp or something inside, indicating bleeding, and you would need to follow up with colonoscopy. So what we do is we send patients home with this test. There is a lab form in the kit. There's an envelope that already has stamps in it. Our address is on there. It's ready to send back to us. All you do when you're done with your sample is you drop it in the mail. It comes straight to us. It includes a set of instructions just in case patients forget about what we talk about. And we also have these instructions in Spanish, Somalia, Swahili, Burmese, Arabic as well. And then there are what you actually collect the test with. So there's a sample card and a brush kit. So when someone's ready to have a bowel movement, they go into the restroom and they flush the toilet so the water's nice and fresh and clean. This test does look for a chemical reaction, so we want to make sure if they just clean the toilet or there's those blue toilet bowl cleaners that those are removed from the water. They sit down and have their bowel movement, but when they go to clean themselves, the toilet paper goes to the trash can on the side. Or included in this kit, there are 2 blue disposable bags for trash. These bags do not come back to us. Please do not send me a full-size sample. I beg of you, don't do that. So they're done, they're dressed, they're clean, their toilet paper's in the trash can on the side, they're ready to collect their sample. They get one of the 2 blue paintbrushes included, and they just put their finger in and lift up the sample card. The paintbrush is inserted through the top of the water and just gently brushes the surface of the stool. This is not actually collecting a stool sample, this is more of a water sample from the area that the stool is in. They apply it to section 1 and throw the first paintbrush away. They get the second paintbrush. They brush a different area of the stool and again put that water sample there on the card. The sample's collected. On their lab form there are 2 stickers. They just need one of them. They place the sticker up and down on the card to seal the envelope. And then their lab form and this test card comes back to us in the prepaid self-addressed envelope. And that's it. That's screening.
That seems incredibly easy.
It's so easy. They have to make sure they fill out that lab form to get their information. And sometimes we get them back and they're not filled out. So it's really important to fill out that lab form that's got their date of birth, their name, address, and it goes directly to us so that we know how to match it with that person.
Wow, that's so easy and so important, and something that you can do at home if you're intimidated, embarrassed, or anything like that. So this is something easy to do.
And this lets you know if you need a colonoscopy or not. So a lot of people are stay away from screening because they don't want to do colonoscopy. While colonoscopy is the best method of screening because it allows us to actually see polyps and growths, this lets you know, yes, I need a colonoscopy, no, I don't.
Got it.
It helps people take charge of their health and make an informed decision about what they need to do for screening.
Okay, and speaking of cancer screenings information, really quickly, you guys have a great event coming up this weekend.
We do. This Saturday, we have the Cancer Screening Information Fair. This is our 2nd event. It is following one we had in April. We're going to have free cancer screenings available for breast cancer, cervical cancer, and information on tobacco cessation and lung cancer screenings, as well as free colorectal cancer screenings, and our skin cancer screening program will be available as well. These services are free. Some of them do have some requirements, so make sure you're bringing your ID in or a paycheck stub so we can make sure, especially for the breast screenings. But we have several appointments available to do same-day screenings there. We have, of course, the colorectal test that we send home with you. We have all sorts of doctors available, medical students, so just any information we can give you, we're there. And we're also offering free lunch. If you like Chick-fil-A, come see us.
I like it. Very good. Girls, thank you so much. Really interesting stuff today. We appreciate it. Stick around, everybody. After the break, we've got news and weather headlines. Don't go anywhere.